You know, living with the pain and symptoms of fibromyalgia can be more than frustrating for everyone suffering from this condition. So let's take a look at what the future holds for people suffering from fibromyalgia. At this point, long-term follow-up studies have shown that fibromyalgia is chronic, but the symptoms may wax and wane. A greater number of studies involving a large array of neurotransmitters involved in the pain pathway may be most relevant in fibromyalgia research in the future. Obviously, there are going to be more drug studies involving many neurotransmitters, their receptors and subtypes, serotonin, norepinephrine, dopamine, substance P, and their subtypes, among others, are likely targets of more fruitful research with the development of new drugs without significant side effects. Now, researchers are also focusing on further genetic studies of fibromyalgia and other members of the central sensitivity syndromes family. More studies are expected involving the factors that may trigger fibromyalgia, like viral infection, mental and physical trauma, poor sleep, environmental factors such as noise and chemicals, and various psychosocial stresses in childhood and their probable ability to cause long-term neuronal plasticity among the adults. The key to unlocking the mystery of fibromyalgia has yet to be found. Research scientists have been studying numerous viruses as potential causes for fibromyalgia. Identification of an infectious agent or toxin which causes the disease may one day lead to a laboratory test that can help doctors diagnose this condition. Specific treatment aimed at a cure awaits future research that uncovers the exact cause of the disease. Now, recent scientific studies suggest that a specific area of the brain called the insula may be involved in the pathophysiology of fibromyalgia. With ongoing research, the future will certainly improve for those affected by fibromyalgia. Advances in medical science and an increasing number of clinical trials have led to greater recognition of fibromyalgia by the medical community, the pharmaceutical industry, and the general public. Research has also resulted in better diagnosis and treatment, along with the development of new therapies specifically targeting fibromyalgia. Now, perhaps most importantly, it's helped to validate the experience of the many people who battle this condition, often for years, with little medical or social support. So while research is yet to uncover the exact cause of fibromyalgia, new laboratory tests and brain imaging technology have confirmed the existence of brain abnormalities in people who have this disorder. Now, these irregularities could be the reason behind many common fibromyalgia symptoms, including the widespread pain, the sleep disorders, the chronic headaches, memory and concentration problems. Now, this is significant because it's shaping the direction of fibromyalgia research. Other research currently underway is looking at brain responses to pain in people with fibromyalgia. The effectiveness of new and existing medications to treat fibromyalgia symptoms like pain and insomnia is going to be a critical outcome of this research. Now, complementary therapies like Tai Chi and acupuncture, yoga, and Qigong are already well accepted as adjuncts and effective therapies for managing the symptoms of fibromyalgia. Now, coping skills training for people with fibromyalgia is critical because the role of stress hormones in the body and the possible genetic predisposition that make a person more prone to fibromyalgia is obviously a major issue in this condition. So as more people are becoming familiar with fibromyalgia, healthcare providers are beginning to accept it as a real and serious condition. More studies are being funded. Physician and patient education programs are now widely available. More support resources exist for people who have fibromyalgia. There is hope. Meanwhile, there is still a long way to go, but there's more hope, more help, and a brighter outlook every day, especially if you're willing to look beyond medicine and explore a new way of thinking about fibromyalgia. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my Fibromyalgia Roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.